Meanwhile, the FDA has granted emergency approval to a new antibody test that claims to have 100% accuracy. For more on this, let's bring in Dr. Shoshana Ungerleider. She's an internal medicine physician at Sutter Health in San Francisco. Dr. Ungerleider, good to see you again. So we've been talking about antibodies lately. I guess the first thing, before we even talk about what difference it makes when it comes to immunity, is just describe for our viewers what antibodies are, what these tests could potentially do, and then whether or not it makes a difference when it comes to being immune from COVID-19.
Thank you, Vlad. So yes, let's first talk about what an antibody is. These are proteins that are found in the blood produced by the immune system that help defend the host against foreign invasion, essentially. So what does it mean if you have antibodies to a virus? It means you've been exposed to that virus or you've had a vaccine for it. So having antibodies doesn't mean that you'll be able to fight off a second infection necessarily. And in the context of COVID, I think we shouldn't get ahead of ourselves here. I think that the fact remains that we don't know yet how long these antibodies last, the degree to which people with coronavirus antibodies are actually protected from getting COVID a second or a third time. And, aside from this latest FDA approved antibody test that we're hearing about that's highly accurate, I should also point out that we don't even know if most of the other 100 or so tests that are out there on the market are even close to being that accurate. So I think we're all very eager to return to some version of regular life here, to widely use this antibody test to reopen society. But I think we just aren't quite there yet. We need to really rely on the science, especially when we're talking about people's lives.
Do we have any idea what a second bout with COVID-19 would look like? Would it be easier or would it be harder because your body has already sort of been beat up by it the first time around?
Yeah, this is a great question, Anne-Marie. I think first we should be asking, are some people getting reinfected? We know some people who've recovered from COVID with negative tests, they're testing positive a few weeks later. So why is this? And I think the answer is we don't quite know why. It's possible that there could be fragments of the old virus that are being recognized by the test, or it could be something else. So it's not clear at this point whether this is clinically significant, whether people are in fact getting a second infection or not.
So, doctor, as you know, the federal government is beginning to ship remdesivir to hospitals across the United States this week. The drug has statistically no significant effect on a patient's fatality rate. So why was it authorized by the FDA for emergency use?
Yeah, that's right, Vlad. Remdesivir is an antiviral medication that's administered through an IV. Initially, just so people know, developed as part of a treatment for Ebola. It's currently limited to hospitalized patients with very severe illness due to COVID. And as you pointed out, in this study, remdesivir shortened the time to recovery by about 4 days on average for hospitalized COVID patients, but it had no statistically significant effect on whether patients died. So it's also important to note that there's still very limited information known about the long-term safety and side effects of the drug. I think that the reason why the emergency use was granted and this was fast-tracked is that we're looking for something to help here. But the bottom line is that this early data is encouraging that there is some effect, but this is not a cure. And the data needs to be looked at rigorously going forward.
So Dr. Anthony Fauci basically said that it's inevitable that there will be sort of another round of COVID-19 in the fall. Why in the fall?
Well, despite the fact that we've seen the spread of the virus slow down in many parts of the country because of the social distancing efforts we've all been a part of, I think public health experts agree that a second round of COVID-19 cases is very, very likely to happen, as you pointed out, especially as more states alter their stay-at-home orders. We know this virus is so contagious It quickly spreads from person to person, and it's so widespread across the country. So, that's why we're thinking that come a few months from now, we'll be seeing this second wave. And I'm concerned that this combination of a second wave of COVID coinciding with flu season ramping up this fall could make things much worse and potentially create a lot of confusion because of the overlap in symptoms between COVID and the flu. And of course, this may put a heavy strain on an already taxed healthcare system. So I think we need to be preparing for this now.
In fact, Dr. Ungerleider, you just answered the question that I was going to wrap this discussion up with, because I've heard you and other doctors say that if there is a second wave, that it could be worse than this current one. And I just sort of wondered why that might potentially be. But so you're saying essentially, as we enter flu season and the coronavirus rears its head again, you're talking about thousands more people getting sick and an already strained medical system coming under even greater pressure.
Yeah, that's right. We're seeing this happen in other countries, and as social distancing measures are being relaxed, all over, we're expecting to see it happen here. I think one thing to note is that there's a lag time of a few weeks between infection and symptom onset. So as we're starting to reopen in many places, we may not see an immediate rise in new cases across the U.S. But right now is when we really need to be preparing for a second outbreak, whenever that happens. Healthcare facilities need to be stocking up on personal protective equipment and testing supplies. City and state officials, as well as the public, need to prepare and to understand that places may need to quickly reissue stay-at-home orders if, in fact, these local outbreaks start occurring. And we, of course, need to continue focusing on expanding testing and contact tracing. I think, we should all remember that the novel coronavirus is only 16 weeks old. So there's a lot we just don't know yet. And while I think it's important to remain hopeful, but just because we've, flattened the curve in some places, people need to be aware that this virus has not gone away. It is still there. And we need to remain vigilant. And people should stay home if they can and stay safe.
All right, Dr. Ungerleider, thank you very much. As always, we appreciate it.
Thank you.